Thanks a lot, Connie, for all those detailed sharing, and also thanks for Tony's introduction of the overall work. So I'm actually having the privilege of sharing with you some of our understanding on the clinical perspectives of how to apply the Hong Kong Growth Chart 2020. As you realize from our early sharings, the new growth chart actually, one of the main difference from the previous one is the adding of the two centiles. Now, from the past is 7, but now we are adding to 9. In particular, we have been actually using new two extremes, 99.6 and also the 0.4. So it would make some difference in the future clinical use. Now, the basic principle I actually appreciate most of you would come across with is what Connie just briefly shared. Growth measurement itself is not too meaningful. So actually, it is actually how to measure accurately, plotting on the growth chart, and with appropriate interpretation would be even more important. Now, so besides the then standard method of measurement, the correct plotting and also a better understanding about the different centile and the interpretation would be one of the ways that we are going to do it together. Now, for the head circumference, you probably realize the head circumference itself is basically reflecting the brain growth as well as how a child was serving in a favorable environment. So to a certain extent, failure to obtain an accurate measurement may delay the identification of an infant and a young child with the health and developmental concerns. So that's why we are particularly interested to share with you about how we can properly clinically apply all those head circumference. That in general, head circumference reflect the brain size. As you probably know, when we actually delivered as an infant, our brain would grow rapidly, and actually our skull bones have left a lot of leverage in order to have a flexibility to allow brain growth, and then with a rapid increase in the head circumference, in particular in the first half to 1 year. But to a certain extent, it's also been a very useful parameter for screening of the potential health, nutrition, and the different sorts of developmental problems. Now, we defined microcephaly as those less than or equal to the second centile, macrocephaly as those defined as larger or equal to 98th centile. Now, of course, as you probably realize in all your clinical experience, the parents' head circumference usually would serve to be a good reference. So in general, those parents with a bigger head is also more likely to have a younger child with a larger head circumference as well. Now, when we are looking at the new growth chart, we divide them into those between 0 to 2, and then those older than 2 up to 18. Now, this is a typical growth chart in the boys that we are going to adopt soon afterwards, and that is for girls. We adopt a very similar approach previously, but adding some reference that you can add in the parents' head circumference in both father and mother, and you can also record some of the different dates of the measurements. Now, as you mentioned earlier, in this new growth chart, the body length and the body height, this is another very important perspective that we would like to focus. Now, short stature is defined as the body height less than the second centile on the growth chart. Now, in simple terms, that means those who are shorter than the second percentile will be regarded as short stature. Now, as you probably realize, short stature, there are a lot of different causes. Most of the time, it is idiopathic, can be defined as a short stature with a normal birth weight. Usually, there would not be any apparent hormonal issues, normal growth hormones, normal thyroid hormones, and without any evidence of other systemic, endocrine, nutritional, skeletal, or genetic abnormalities. But on the other way, constitutional delay of growth is in general a transient period of deceleration of growth and is more prevalent in boys than girls. Usually, there may be a positive family history when one of the parents or siblings or one of the relatives also had a history of constitutional growth delay. For those with familial short stature, obviously, you need to look for the family history of those parents who are short and also presented with an early deceleration in the linear growth, all depending on their original birth parameters. And the final adult height is short, but can still be quite appropriate for the mid-parental height. Now, Connie just briefly shared with you the importance of the mid-parental height, but as you probably know, mid-parental height is not used for the prediction of the adult height, but actually shared as a very useful comparator that we can compare with the assessment that when a child was coming for a suspicion of short stature. And auxiliary growth assessment tool, mid-parental height comparator, was created in a new flowchart in order to facilitate the use of our healthcare professionals. As you probably realize, majority of children's height centiles are within the 2 centile space above and below the mid-parental centile. And compare with the parent's height should not be just seen as a test for normal height, but actually is as a good reference when a child seems to have an abnormal growth. Now, this is the mid-parental height comparator that we generate for the new growth chart. As Connie just demonstrated to you, when you plot into appropriately the father and the mother's height, and then when you see the intersection point, it could give you a rough idea what would be the likely mid-parental height, as well as the location of the centile of the mid-parental height. And in the new Hong Kong 2020 height for age reference at 18 years old, the mid-parental height parameter is particularly generated for this purpose. Now, for example, if you got a mid-parental height centile of a mother of 153 and the father of 176.5 centimeters, that means roughly it would equivalent to a 40th centile for both boys and girls in terms of the mid-parental height. Now, the approximate height centile for the mothers, fathers, and the mid-parental height actually can be estimated from this new comparator. As we discussed earlier, majorities of all those children's height in the new Hong Kong 2020 growth chart, actually up to 90% of them are within the 2 centile space of the mid-parental height. But having said that, it is not a prediction of the adult height. Now, one of the key limitations when you are applying this new tool in your clinic and although the different clinical setting is that accuracy of the parental height. Now, although mid-parental height can provide as a useful guide to expect the height centile for children and the parents of average height, sometimes it can be quite misleading when used to assess short children. Now, there's usually a significant difference in the paternal measures versus the self-reported heights with an overall trend of the fathers to overestimate their own height. And to a certain extent, when a child's growth is in question, better do a measurement rather than just rely on the reported height from the parents. Many of the times have been proven to be quite inappropriate. Now, inaccuracy can be even greater when one parent reports the other parent's height. When a child's growth height is in question, better measure it in your clinic as much as possible. So another key question when using the new Hong Kong Growth Chart 2020, how do I know whether the parents, how can I explain to the parents that their children who were all along slightly around the 3rd percentile, but because of the new growth chart, it dropped to less than 2nd percentile in the new chart? Now, you can just explain to the parents the slight drop is due to a difference in the comparison group between those children in 1993, that is the old growth chart, and the new growth chart, we collected data in 2020. The new chart is derived from the children's measured recently in the past 2 years, and those children on average are found to be taller than those measured in 1993. So the slight drop of the height centile for the same height actually will happen to children at all ages, and parental height also at the transition of the growth chart. You can inform the parents that it is important to monitor the gain in the body height or to measurement the change in the height velocity, rather than focusing on the absolute centile of one single measurement. Now, in the new growth chart, BMI, the body mass index, actually played an important role. Now, you probably realize the body composition data show that higher BMI centiles sometimes can overdiagnose obesity in younger children, particularly for those less than 6 years old. Now, this is because the raised fat levels are much less common at the younger age group compared with their older counterparts. Also, that's why younger children with a higher BMI centile have lower fat mass index than the older children with the same BMI centile. So that's why we think it would be more appropriate to consider a different cutoffs applying for the different age groups. Now, in the new Hong Kong Growth Chart 2020, we divide actually the cutoff for the different age group between 0 to 2, 2 to 5, and then the 5 to 18. Now, in general, for those who are younger age group, the definition would follow the location of the BMI between the 99.6 and then the 98th percentile, defined as overweight. For those extreme bigger than 99.6, we would define as obese, and for those less than the 2nd percentile would be a case of wasting. Now, for those older age group, we are using a little bit different definition. For those BMI between 98 to 91st centile regarded as overweight, and for those extreme bigger than 98th percentile as obesity, and the same principle applying for those less than second centile as wasting. Now, this is another set of same criteria for the girls in the different age group using the BMI to define obesity and overweight as well as wasting. Now, in the new Hong Kong 2020 growth reference, actually, we do not include the weight for length and height as the previous old growth chart. It is because of the previous experience worldwide, particularly with the recommendation of WHO in many countries. Actually, the body shape related to height would vary by age in the young children, making the ratio of the weight to length or weight to height is an unsatisfactory marker of obesity. So that's why in the new growth chart, in reference with all those nearby areas, the childhood obesity will be defined by the BMI for the age instead of the weight for length or weight for height. The change will be consistent with the practice in many other places in the world. BMI itself is an indirect measure of the body fat because it does not distinguish between excess fat, muscle, or bone mass. So intrinsically, you should be aware that there will be some limitation when you interpret the BMI data, because some children may be stronger with a bigger muscle mass. Some of them actually have been born with a higher body mass density. So that would also affect not just the fat composition, but also the overall impression. So among those children with the extreme high BMI, but BMI seems to be still a very good indicator of the excess body fat. Abdominal circumference obviously can also serve as a very useful reference to provide additional information. So we should regard BMI as a screening tool to identify those potential weight problems in the different individuals. Now, when we are looking at the weight status, the new growth chart actually has been using the BMI to identify the different group of weight status. Now, weight is a routine measurement in the maternal child health center for children under 2 years old, but not the body length. In general, body length in an infancy is much more difficult to measure, and also in general, less reliable. So this is another set of growth chart in the body weight for the boys at a different age group. Now, finally, we just let you have an understanding about the new cutoff for the growth problems in the new Hong Kong growth chart application. For the head circumference, BMI, body weight, actually, we define the different cutoffs in order to recommend our colleagues working in the different settings in the primary care office, in order to define which kind of cases that they would need further doctor assessment and potential specialist referral, and what kind of cases, for example, for those with a head circumference between the 0.4 and then the second centile, would be those that would need your attention, further monitoring, and further consider whether referral and then detailed assessment would be necessary in the longer run. Now, in general, for the body weight, we use the same definition, looking at the growth faltering in infants as defined by the weight for age declines across for 2 or more centiles. So in application of the WHO 2006, Tony actually has shared with you a very good summary. But in Hong Kong, our recommendation is that for those non-Chinese children, given that Hong Kong growth chart 2020 was developed mainly from an ethnic Chinese Hong Kong population, but on the other side, the WHO 2006 was developed from a sample of 6 countries. It would be a reasonable argument that the WHO 2006 could serve as a better choice for all those non-ethnic Chinese children at a younger age group. Now, so compare with the Hong Kong New Growth Chart 2020, the WHO 2006 can screen out fewer infants with growth faltering for follow-up because infants in Hong Kong have lower birth weight than the median birth weight from the WHO 2006 study. And the variation of the growth was also greater with a wider standard deviation amongst those children recruited from the 6 different countries involved to construct the growth chart WHO 2006. Now, healthcare professionals should be aware of the lower weight of Hong Kong infants below 2 months and the shorter children aged 3 to 5 years old when compared with the WHO 2006 growth standards to ensure a correct interpretation when using these different growth charts. All centiles actually can be normal, so don't just look at the centile itself. Particular centile 9 sometimes could be not so optimal in a different interpretation. Now, growth chart users should pay attention and need to observe the trends and also consider the different factors, particularly those involving the genetic and the different growth potential when monitoring the growth of a child. So I'm going to hand on to Annie to share about much experience in maternal child health center and the different health settings.